Hi there, Dr. J here. We're going to talk a little bit about piriformis syndrome today. Piriformis syndrome is a very common condition that leads to sciatic nerve irritation, and we see a lot of that in our office. So first, let me show you what the piriformis muscle is. Here's a model of the pelvis here, and I'm going to take the pelvis and I'm going to put it over the top of our patient's pelvis so you can see exactly how it lines up. You have your hip bones here, which are your iliac crests on both sides, so they would be running right up here. And then your femur joints, which are actually your hip joints, join in right here into your pelvis, and they connect, and that's where this is the rest of your leg. So what we have here is a piriformis muscle. Is a very small muscle. It attaches on the iliac crest, and it runs from the iliac crest to the femur joint in this direction. It's a small muscle. It lies underneath all the other muscles in your pelvis, in your buttocks, your gluteus maximus, your gluteus minimus. Now here's the problem. When there's a pelvic misalignment, when the pelvis is not in position the way it's supposed to be, and when it's fixated, it causes this muscle to contract and get tight. Well, the biggest problem with that is the sciatic nerve runs right through the middle of this muscle and runs through your butt cheek and down your leg. So we have to get this muscle to relax, and we have to get the pelvis lined up, and then that'll take the pressure off the sciatic nerve. The issue is that to get to this muscle, we have to go pretty deep into the buttocks. We have to get through the gluteus maximus and medius muscles and then get into the piriformis right here. And that should be on her, that should be pretty tender on her right now. So she can feel that. So I'm on that piriformis spot. So I'll tell you what we've already found is that in this case, the sacroiliac joint is out of alignment. It's coming backward this way. It's causing the ischial tuberosity to fixate over here. So the pelvis is off. It's off-centered. You can see how this side's higher up than this side. So what we're going to do now is we're going to use a chiropractic adjustment, a drop table technique, where we'll using momentum, we'll push the joint as the piece drops. My momentum goes through the joint, and we're able to get the pelvis to drop into position. I have to get my hand, this opposite hand, on the ischial tuberosity. That's your butt bone that you sit on, the hard bone right here, because we have to push it up this way. And then we take the pelvis and push down that way. And we're going to do that a few times. Are you okay?
Fine.
She's fine, so it doesn't hurt. It makes a lot of noise because the table drops loudly, and we're on a hollow floor here as well. All right, so that should do that trick. Now, the other thing we found when we were doing our analysis is that the sacrum, which is the triangular bone that sits in between the pelvis here, you can't really see it on this model, but that's it there. And then your coccyx, which is your tailbone, sits at the very bottom. That would be what the sacrum looks like for the front view. And as you can see, these are the nerves, and they come out all through little holes in the sacrum. And then the big nerve goes through your pelvis, and as I said, it comes out here on both sides. You can see it right here. And then it goes through the piriformis muscle. So what we found on this patient is her sacrum has a right rotation, a sacral apex right. So we're going to get our hand on the sacrum like this. I'm going to lift up the table, and we're going to rotate the sacrum back to the midline. So we're going to go, but we're going to get the tension right because it's a lighter adjustment, so it doesn't need as much force. And we just do that. It's just a little rotation with my hand on the sacrum. My pisiform on my hand is digging into the side of her sacrum, and then the rest of my hand is pushing into her butt cheek. And then we're just going to do that a few times. Now what happens with the piriformis muscle, as I showed you in the model, connects to the hip joint right here, the femur joint. So when that muscle contracts, it takes the whole leg and it externally rotates it. So that'll also keep the muscle contracted. So what we have to do is we have to adjust the femur joint in internal rotation. So we have to go the opposite of external. So we're going to get this attachment on the arthrostim instrument, and we're going to rotate the femur joint this way. And then she also has a femur head superior fixation, so we're going to drive it down. And it's gone lateral, so we're going to push it medial. Now, since we already have this attachment on here, we're going to back up that drop table adjustment and tap her sacroiliac joint down. And then we're going to push her ischium up and get the sacral apex from right back to midline. How you doing?
Oh, I'm fine.
Okay. All right, so that is the adjustment for the pelvic imbalance that's causing the piriformis syndrome. What we would do afterwards is we would teach the patient certain stretches they can do for self-care at home, where we're stretching the piriformis muscle to keep it loose so it doesn't contract and pull the pelvis out again. And then within a few repetitive visits, we can get this correct and taken care of. So that's our discussion on piriformis syndrome.